Hi, I am Dr. Prudwiraj, Consultant Endocrinologist and Diabetologist at Arete Hospital, Gachibowli. Now I am going to debunk some common myths regarding the diabetes. The first myth is many of the patients have this myth that once we start them on insulin, they will be on insulin for their lifetime. It is not true for all the patients. The decision to start insulin depends mainly on their sugar control and their other comorbidities. If their sugar control is very bad and HbA1c is more than 10 or 11, then we try to give them insulin for a certain period of time. Then after we gradually increase the medication and de-escalate the insulin, and we can stop insulin most of the patients. There are other set of patients where they may require insulin for a lifetime, but this myth is not true for majority of the patients. The second myth is diabetic patients think that they cannot eat fruits, as fruits is rich in sugars. See, it is not entirely true again. Fruits are rich in sugars, nutrients and the fiber content also. You can take them in moderation, and there are specific fruits which you need to avoid if your sugars are too high. Any fruits, low glycemic index fruits can be taken in moderation. You can take 2 servings of fruits per day, but when you are consuming fruits, make sure that you are giving a gap of 2 hours at least for the major meal before and after consumption of the fruits. With this gap and within moderation, you can consume low glycemic index fruits like one medium size apple or one orange or 1/4 papaya or one guava or one bowl of kiwi or dragon fruit. All these low glycemic index fruits can be consumed in moderation. Third myth, all gestational diabetic mellitus patients need medication or insulin. It is also again a myth. Majority of the patients, around 60 to 80% of the patients who got diagnosed with gestational diabetes in pregnancy do not require any medication or insulin. It can be managed only with medical nutrition therapy, that is a disciplined diet and a regular walking and exercise regimen. So majority of the patients don't require any medication or insulin for gestational diabetes. Fourth myth, pre-diabetes, all the pre-diabetic patients will eventually convert into type 2 diabetes. It is again partly true, but it is again partly false. The pre-diabetes status can be revert back to normal if you can able to manage your healthy diet and a regular exercise pattern and a healthy sleep and stress management. There are a couple of things which are not in our hands, especially age and genetics, which make pre-diabetic people to get converted into type 2 diabetes in the future, but this is not true for all the patients. Majority of the times with adequate lifestyle modification, pre-diabetes can be reversed and they kept under control. The fifth myth I am going to debunk is type 2 diabetes happens only for the overweight or obese people. Again, it is not true. If you have a family history of type 2 diabetes, you are prone to get type 2 diabetes even if you are normal weight. And again, body fat percentage is more important than the weight or body mass index. So if you have a strong family history or if you are elderly age, you are prone to develop type 2 diabetes even if you are not overweight or obese. If you want me to debunk more myths, kindly mention in the comment. Thank you.